Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today I'd like to talk to you about low testosterone or testosterone deficiency, which is a condition that can significantly impact men's health and quality of life. Let's start off by talking about testosterone. Testosterone is a hormone primarily produced in the testes, and it plays a major role in male development. During puberty, it's responsible for changes like a deeper voice, muscle growth, and the development of facial and body hair. Beyond puberty, testosterone is essential for maintaining muscle and bone strength, red blood cell production, energy levels, mood stability, and sexual function. When testosterone levels are too low, it can result from various underlying factors including hormone imbalances, medical conditions, or lifestyle influences. One medical condition commonly linked to low testosterone is hypogonadism, which occurs when the body isn't able to produce enough testosterone. Hypogonadism can either be primary, meaning it originates in the testes, or secondary, which results from issues in the brain, specifically the hypothalamus or pituitary gland. Primary hypogonadism might be caused by genetic conditions like Klinefelter syndrome, injury to the testes, or medical treatments like chemotherapy. Secondary hypogonadism, on the other hand, can stem from pituitary tumors, obesity, or chronic illnesses. Your doctor can determine the cause of low testosterone through blood tests and other evaluations. Now let's talk about how common this condition is. Low testosterone is not uncommon, especially as men age. Around 20% of men over 60 have low testosterone, and this increases to 30% in men over 70 and nearly 50% in men over 80. But age is not the only factor. About 2% of younger men, especially those under 40, may also experience low testosterone, often due to medical conditions such as obesity, diabetes, or hypogonadism. Globally, low testosterone affects between 10% and 40% of men, and the rates tend to be higher in areas with higher cases of chronic diseases, such as diabetes or obesity. Risk factors for low testosterone include not only age, but also health conditions like autoimmune disorders, type 2 diabetes, HIV, liver disease, and even long-term alcohol use. Lifestyle choices such as poor nutrition, lack of exercise, smoking, and disrupted sleep patterns can also lead to hormone imbalances. The symptoms of low testosterone can vary widely. Physically, you might notice reduced muscle mass and strength, increased body fat, thinning hair, fatigue, reduced sexual desire, or even difficulty achieving or maintaining an erection. Low testosterone can also decrease bone density, increasing the risk of fractures. Mentally, it may cause mood swings, irritability, depression, or a lack of focus and motivation. Some early signs to watch for include persistent fatigue, reduced physical performance, and a loss of interest in hobbies or daily activities. If any of these symptoms sound familiar, it's important to talk with your doctor. Low testosterone can sometimes be a sign of a more serious condition. For instance, sudden, severe fatigue, unexplained bone pain, or erectile dysfunction combined with other health changes shouldn't be ignored. To diagnose low testosterone, doctors use a combination of symptom assessments and blood tests. These blood tests, often performed in the morning, measure testosterone levels and compare them to normal ranges. If your levels are low, additional tests might be needed to identify whether the problem is primary or secondary hypogonadism, and to rule out other causes. Treatment often includes testosterone replacement therapy or TRT, which comes in various forms. These include topical gels like androgel, patches, injectable options like testosterone enanthate or testosterone endocanoate, nasal gels such as Natesto, and implanted pellets like Testopel. There are even oral options like Kyzatrex, which offer convenience. Each method has its pros and cons, and your doctor will work with you to choose the best option based on your health, preferences, and cost. That said, TRT isn't without risks. The FDA has stated that TRT should only be used in cases of hypogonadism and warned against using it solely for age-related testosterone decline. Studies have shown that TRT may increase your risk of heart issues such as heart attacks, strokes, or blood clots. For example, one study found a 30% higher risk of heart complications in men using TRT, and another found that older men or those with pre-existing heart conditions may have an even greater risk. In addition to medical treatments, lifestyle changes can also help improve testosterone levels. Regular physical activity, particularly strength training, has been shown to boost testosterone. Getting enough sleep is key because disrupted sleep can interfere with hormone levels. Managing stress is another important factor as high stress can increase cortisol levels, which can suppress testosterone production. Cutting back on alcohol and avoiding smoking can also support better hormone health. Low testosterone is not just about lab results. It's about how it impacts your daily life and long-term health. Untreated low testosterone can lead to issues like decreased bone density, which increases your risk of fractures and can also increase your risk of developing conditions like type 2 diabetes or heart disease. If you're experiencing symptoms of low testosterone, don't hesitate to talk to your doctor. They can help you determine the best path forward, whether that's TRT, lifestyle changes, or a combination of both. Remember, testosterone plays a significant role in your physical, emotional, and sexual health, so addressing these changes can have a big impact on your overall well-being. You can read more about low testosterone and TRT on our website, so check those articles out in the links below. And if you have any questions, be sure to ask your doctor or leave them in the comments below. Bye for now.